Hey y'all, we are taking a look at this neat model of the nervous system. It shows other things, but mostly nervous system. You can see it's this wireframe, half person. You can see a hand and a foot there. We're going to go over this in parts. There's a lot going on here. So let's start with the head. Let's take a look at some brain regions and some cranial nerves. So basic lobes: frontal lobe, parietal lobe, occipital, temporal lobe. Here's the lateral sulcus. Here's the longitudinal fissure. This sulcus right here, that's separating this gyrus from this gyrus. This is the central sulcus. So this is the precentral gyrus that houses the primary motor cortex. This is the postcentral gyrus that houses the primary somatosensory cortex. And it's also the border between the frontal lobe and the parietal lobe. You can see the cerebellum, of course, over here. On the underside of the brain, you can see in pink, that's the olfactory bulb and olfactory tract here in white. Optic chiasm, it's not shown very well, but that's optic nerve that's cut right there. So the chiasm is right here. This bulge here, what's labeled as F, that's the pons, so the midbrain's deep in here. Here's the medulla, and this pink thing is representing an olive. So this midline is a medullary pyramid, and there's an olive. As far as what we see in the back here of the spinal cord, we can see, let me show a few more things. We can see some of the layers of the meninges. Pia would be directly against. Arachnoid is here. Dura is the very outside closest to the bone. And you can see that the spinal cord has been exposed here. We've cut away the spinous processes. Here's the lumbar vertebrae, L1, 2, 3, 4, oopsies, 1, 2, 3, 4, 5, there we go. And then the sacrum. So around L1, L2 is where the spinal cord's ending. This is where the cauda equina would be. J is supposed to represent the cauda equina, and the lumbosacral enlargement, and conus medullaris ends around there. All right, moving on to the cranial nerves. So cranial nerve number 1, olfactory nerve, that's represented right here. You can see that it would be going through the olfactory foramina of the cribriform plate of the ethmoid, ending there in the olfactory bulb. That's for smell, of course. Cranial nerve 1, olfactory nerve. Cranial nerve 2, it's not labeled here, but again, you can see it cut off right there. That's the optic nerve for vision, cranial nerve 2. Cranial nerve 3, labeled here as 19, that's oculomotor. You can see it's coming out near the midbrain, posterior, sorry for all the shaking, posterior a bit caudal to the optic chiasm, oculomotor number 3. Number 4, it's tucked away here, it's a bit more lateral, that's trochlear. Number 4, which is labeled as 20, trochlear nerve, that's for the innervating the superior oblique muscle of your eye. Cranial nerve 5, your thickest one. This is the trigeminal. Trigeminal is just lateral of the pons. It's labeled here as 22. And you can see it splits into 3 divisions. That's why it's called trigeminal. It splits into a ophthalmic, maxillary, and mandibular division. But this large nerve here is trigeminal, number 5. Number 6, here's number 6, labeled as 42. That is the abducens nerve. Abducens controls the lateral rectus so that you can move your eyes outwards to abduct your eyes. That was number 6. Number 7 and 8 are really close to each other. 7 is the one on top here. They're all bundled here. 7 is facial, 8 is vestibulocochlear, and then also here labeled as 47. That's number 9, hypoglossal. So they're very close to one another, especially facial and vestibulocochlear. Both facial, which is labeled as 43, and vestibulocochlear, which is labeled as 46, both of those go through the internal acoustic meatus. Glossopharyngeal, number 9, labeled as 47, that passes through the jugular foramen. That was number 9. Number 10. Number 10 is the vagus nerve. It starts here off the medulla, and it's really long. You can see that it's going to innervate a bunch of things. It'll innervate things in the mouth area, oral cavity, and salivary glands. It'll go down, innervate the aorta. It'll innervate the stomach. It'll innervate the heart. The heart's not shown here. It's your longest cranial nerve. The vagus nerve number 10. The vagus nerve number 10 is really important for your parasympathetic nervous system, controlling things like digestion, heart rate, slowing things down. Slowing your heart rate down, but increasing digestion. Rest and digest. All right, so that was vagus number 10. Number 11, it's shown as small here, but it really should branch more. Number 11 is shown here as 60. Number 11 is the accessory nerve, spinal accessory. It's supposed to innervate things like your trapezius and your sternocleidomastoid. That's labeled as 60. And number 12, your hypoglossal nerve, it's shown on the other side. It's supposed to come in between your olives and pyramids. It's labeled here as 61. So it's coming out deep there, and if we track it, if we follow this nerve down, we can see that some of it branches deeper into the jaw, into the mouth. This is going to innervate this nerve that's going diagonally. That's going to innervate the tongue. The hypoglossal nerve controls tongue movement. All right. I can do that real quick one more time. Cranial nerve number 1, 2, 3, 4, 5, sorry about the focus, 5, okay, 6, 7 and 8 and 9 are all packed in here. 7, 8, and 9. 10 is this long one. 11 right here. And then 12 is tucked away, labeled as 61. 12. All right. Those are some important brain regions and the cranial nerves on this model. Take a look for more about the spinal nerves.